Kia ora, good afternoon. We're bringing you the latest on New Zealand's COVID Delta outbreak. We'll take you soon to a news conference at the Beehive Theaterette where the Director General of Health will provide an update on the New Zealand cases. But first, let's take a look at the day's developments. Auckland will stay in level 4 at least another week. Cabinet made the decision after 33 new cases were reported yesterday. There were 17 so-called mystery cases, but the Prime Minister says only a handful of them are concerning public health officials. There are 7 key suburbs in Auckland where residents are being urged to get a test even if they don't have any symptoms. Those suburbs are Mount Eden, Massey, Mangere, Favona, Otara, Papatoetoe and Manurewa. Yesterday there were 21 people in hospital, 4 in intensive care. Well, political reporter Amelia Wade joins us now from Parliament. And Amelia, we saw case numbers climb again yesterday. What can we expect to hear today?
Well, fingers crossed for a drop, but we are at the tail end of this outbreak, and that means that the case numbers can jump around a little bit. So the reason we saw the 33 cases yesterday is because they're household contacts of cases which have tested positive earlier in the outbreak, and we know that there are still some day 12 tests due back, so we could see that larger number come through again today. But we also understand that the Prime Minister will be pushing one thing today, and that is vaccinate, vaccinate, vaccinate. We understand there will be some new initiatives announced today for more Aucklanders to go out and get the jab and encourage to get as many jabs in their arms as possible. And just because of that, because there's a growing pressure for lockdowns to become a last resort, and so the way that we stop doing that is to vaccinate our way out of this.
Now, Amelia, as of yesterday, there were 17 unlinked or mystery cases. But the Prime Minister says only a handful of them are a concern. Why is that?
Yeah, so there's really only 3 or 4 which are causing real headaches for contact tracers, and that's because they can't work out exactly how they caught the virus. And they are worrying because that could hint at undetected chains of transmission in the community. Among the mystery cases, and I've just checked this before I came down, was a man who was admitted to a ward at Middlemouth's emergency department, in Mount Eden flat where 2 people tested positive, but genomic testing shows there's probably someone in between those 2 household contacts. And the third is the parent of the baby who went to the emergency department at Middlemouth on Saturday. And that's why testing is so important, especially in those suburbs that you mentioned earlier, because those are where those mystery cases are. So if you have widespread testing, it'll really give public health officials and cabinet ministers confidence that the outbreak is actually contained, even if you can't find out exactly how those cases did catch the virus, the epidemiological link.
What's your feeling here? Will all those mystery cases need to be solved before Labour can exit level 4?
Not necessarily. Again, it all comes down to that testing. So if there is really widespread testing across the community of anyone who even has so much of a sniffle, and there's really widespread surveillance testing at those essential workforces like the supermarkets, the health workforce, then that can give confidence to cabinet ministers and health officials to move Auckland out of that full-blown lockdown level 4 and move it into lockdown level 3, lockdown with takeaways.
Amelia, thank you very much for that. And I think we just saw the Prime Minister walking behind you. We'll have a quick check over to the Beehive Theaterette. And it sounds like they're just about to head up there shortly. In fact, there she goes there. So just repeating, yesterday we had a jump in case numbers. 33 were announced. It's hopeful that those numbers may come down again. But the real key thing here is, of course, those mystery cases, and particularly the 7 suburbs. So let's go to the Prime Minister, Jacinda Ardern, and also the Director General of Health, Ashley Bloomfield.
Ina mana, ina reo, ina karangatanga maha, tēnā koutou katoa. Before I begin today, I'll hand over to Dr. Bloomfield to give us the latest case numbers. Dr. Bloomfield.
Ngā mihi perimia. Tuatahi, e mihi ana kia koutou katoa, e whakarongo mai ana. E mihi ana ki te kaupapa o te wiki anō hoki, ara ko te wiki o te reo Māori. We're in the second day, as you know, of Te Wiki o te reo Māori, Māori Language Week. Kia kaha te reo Māori. On the Auckland outbreak today, we are reporting 15 new community cases of COVID-19, and they are all in the Auckland area. That takes our total number of cases in this outbreak to 970, of whom 397 people have now recovered, which is good news. The fall in the number of cases today is encouraging, and even more encouraging is that there are no unlinked cases today. All of these new cases are household contacts from 5 known households, with the majority linked to just 3 households. We do know, of course, that Delta spreads more easily within households, so to some extent, these new cases were expected. While some of these houses have not yet been epi-linked to the wider outbreak, they have not popped up unexpectedly. Furthermore, you will recall that just one case from yesterday was, as at the point in time we announced yesterday, not linked to the outbreak. That case has now been linked. The number of cases in the last 14 days that are not yet epidemiologically linked has now fallen to 10. There are 22 people currently in Auckland hospitals, and of those, 4 are in intensive care and all require ventilation. It does remain crucial we maintain high levels of testing in Auckland to detect any final cases of COVID-19 that there may be in the community. High rates of testing will help Auckland get out of lockdown as planned and stay out. Our priority is now on testing as many people as possible over coming days from the following suburbs in Tamaki Makaurau: Massey, Mangere, Whawona, Papatoetoe, Otara and Manurewa. If you live in these suburbs and you have symptoms, please do and go get a test. If you receive an invitation to be tested, even if you have no symptoms, I would encourage you strongly to take up that invitation too. It is part of our surveillance that we are doing in these suburbs. Of course, anyone across Auckland and indeed New Zealand with cold or flu symptoms, no matter how mild, please come forward for testing. The latest data on influenza-like illness from ESR shows very low rates in the community, so it is particularly important that anyone with symptoms does get tested. We also encourage families with children to get tested altogether, as we are seeing COVID-19 cases in children, including quite a number in this outbreak. So if you're going out for a COVID-19 test, bring your whānau with you. Surveillance testing of essential workers continues across Auckland because they are out and about during Alert Level 4. A wide range of essential workers from a range of industries have been asked to get tested, even without COVID symptoms. These include healthcare, emergency services, workers at petrol stations, transport workers, supermarkets and dairies. Those who are permitted to cross the Auckland alert level boundaries are also required, of course, to provide proof of a test within the last 7 days. And so far this month, since the 1st of September, we have tested 15,685 essential workers across the Auckland region with no positive cases identified. In terms of that testing for people crossing the Auckland boundary, nasopharyngeal swabbing is available, of course, nationwide, whether those workers are in Tamaki Makaurau or outside. Available at testing centres, community testing centres, GP practices, and for a list of testing places, please do go to HealthPoint. Testing, as ever, is free, and please let the tester know that you are doing it for the purposes of crossing the alert level boundary as a permitted worker. On contact tracing, we're now focusing our efforts on 1,242 contacts that are under active management. This is a change to the reporting total contacts for the whole outbreak. The number of contacts under active management is now down to a much smaller number, as I said, over the last 2 weeks, as the majority of our contacts have now either returned to negative tests or have had exposures more than 18 days ago, and we are not generating significant numbers of new contacts outside of households now. On the wastewater side, there was a positive wastewater result received from a sample taken last week in Pukekohe. Our public health team in Auckland advised that there have been 4 cases in the area who have previously been in quarantine who have now returned home. This could explain the result, but what I would like to say is anyone in the Pukekohe area who has symptoms, please do go and get tested. There is pop-up testing available there, and they have increased the people at that pop-up testing to make sure there is sufficient capacity today. There have been no other unexpected detections in wastewater samples taken in Auckland or around the country. Just a reminder too that our hospitals are safe. I've spoken with and had communication from Counties Manako's Chief Medical Officer, Dr. Pete Watson, reminding people in South Auckland, if you need emergency care, do not hesitate to go to the emergency department. There are strict protocols in place to keep you safe and, of course, to keep staff safe. All staff are using N95 masks, goggles and gowns. Everyone who arrives at the ED is very carefully assessed to see if there might have been any exposure to COVID-19. If there's any doubt, they are treated as if they could be. Patients who may have been exposed to COVID-19 or who have symptoms are kept separate from other patients. And Middlemore Hospital is now testing a higher proportion of patients to be extra precautionary who are arriving at ED. Finally, a shout out today for hard-working Auckland paramedics who continue to go each day into the homes of hundreds of Aucklanders to assess them and take care of them and transport them to hospital if needed, despite the current outbreak. Thank you for your dedication to the wellbeing of Aucklanders. Heoi anō, ka nui tēnā, kia ora koutou katoa. Back to you, Prime Minister.
Ngā mihi, Dr. Bloomfield. You may have guessed the theme over the past couple of days has been vaccinate, 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 with a particular focus on Tamaki Makaurau and what we intend to be their last week in level 4. As I said yesterday, there is nothing holding us back in Auckland when it comes to vaccines. There is capacity to administer 220,000 doses of the vaccine in the region this week. If around 130 of those are people's first dose, Aucklanders will hit 80% coverage of first vaccinations in 1 week's time, and we'll be well on our way to the city being better protected against the virus. Let me be clear on why is it important. It literally saves lives and prevents hospitalisations. There's real-world evidence here in New Zealand and internationally that proves you're far less likely to get COVID and far less likely to get sick and need to go to hospital if you are vaccinated. Getting vaccinated protects you, your family, your loved ones and our economy. That's why it's so important to everyone, but especially those in Tamaki Makaurau, to get vaccinated as soon as possible. In fact, if you're sitting at home in Auckland watching this now or listening on the radio and you are yet to get your first vaccine, I'm going to suggest that as soon as I've wrapped up, you go and make a booking. That includes people who may have bookings later in the month or in October. Chances are you'll be able to bring that booking forward to this week. You can do this online at Book My Vaccine. Just remember, though, to cancel your original booking. There are around 90,000 available spaces in Book My Vaccine in Auckland for this week, so bringing forward a booking shouldn't be a problem. And you can also try your GP. More GP clinics and pharmacies are coming online every day. There are now more than 100 GPs and 30 pharmacies delivering vaccinations across Auckland, so give them a call and see if they have any spaces available this week. Meanwhile, our 2 drive-through sites at the Auckland Airport Park and Ride and Truss Arena in Henderson can do over 5,000 per day across each site. No booking is required. You can simply show up. As well as these standard options, there are some other great examples of initiatives that are making the vaccine accessible to everyone. I thought I would touch on a few of them briefly. A pop-up clinic at the University of Auckland for on-site residents, students and staff began on Saturday and has its final day today. It's in the Owen Glen building on Grafton Road. The Northern Region Health Coordination Centre has been running vaccination centres at 4 specialist schools in Auckland, Somerville, Parkside, Wairau Valley and Wilson, with hundreds of students and their families vaccinated at those sites over the last 2 weeks. International evidence tells us that COVID has caused disproportionate harm for disabled people, so we're working hard to get the vaccine to this group of New Zealanders. This morning, Minister for Disability Issues, Carmel Sepuloni, helped launch a Taikura Trust initiative at Papakura Marae to get disabled people vaccinated. They will be prioritising vaccinations for the disabled all week at the marae. The clinic is open from 9 till 3, Monday to Friday, at 29 Hanua Road, Papakura. You don't have to book, but try to be there by 2 p.m. at least, at the latest, so you can be processed. This follows similar initiatives elsewhere in the country. For example, the Hutt Valley DHB and Autism New Zealand provided an autism-friendly vaccination option in Petone. I've heard really encouraging stories of those with autism who have never before participated in a vaccination program accessing a vaccine against COVID. Now, there's been much talk of a Mr. Whippy-style mobile vaccine bus or portable vaccinations. I'm pleased to confirm that the Northern Region Health Coordination Centre will launch its first buses this Thursday. The initial plan is to take them into areas where we know vaccination numbers have been low or people have not been able to access vaccination services as easily. The aim is to increase the network from an expected 6 on Thursday to 12 over the coming weeks. A huge thanks to Auckland Airport and Bus Travel New Zealand, who have supplied buses for this work. I know in Australia they've started operating something similar and have named their mobile outreach clinics Jabba the Bus. I'm sure that we can do better. The vaccine is the best tool we have in our toolbox and our ticket to greater freedoms. The more people who are vaccinated, the fewer restrictions that you have to have. Just as we've been world leading with the success of our elimination strategy, in the future I want New Zealand to be world leading both on the level of freedoms and our health and well-being. And high rates of vaccination is how we can achieve just that. We're now open for questions. Yeah, Benedict. And then I'll come to you, Gina.
Had any updates yet on whether there is a surge starting in Auckland, whether people are starting to turn up in numbers for vaccines?
No, I haven't had an update on that. We do know that, if my recollection is correct, that the 3rd of September was the last date where we had the highest reach. And you would expect that during that period of lockdown in those initial days, we really did have a large number come through. But my message to Aucklanders is you don't need to wait. If you have already booked, but it's not till October, bring it forward. If you've not yet booked anything, please go today to one of our drive-through sites. We want to vaccinate as many people as possible, as quickly as possible, and that goes for all of Aotearoa New Zealand.
Why doesn't the Health Ministry have any plans to randomly test shoppers at places like supermarkets in the known virus hotspots? Yeah,
so we've discussed this question quite a lot. We've talked about the past where supermarkets have been used. And in the past, what our health team have advised us is that supermarkets have been used well when you have, for instance, a wastewater test and you want to do a lot of surveillance testing very, very quickly in certain sites where you haven't had ongoing testing. Their feedback has been that in the current environment, that their testing stations they've established for symptomatic and their asymptomatic plans are still reaching into those communities at high rates. But we continue to say, let's consider everything, and certainly supermarkets have been on our agenda for something that should be considered.
Yes, and just one other point to make is rather than random testing, the testing that's happening in Auckland is targeting specific suburbs where there are households that there is a sense there could be other cases out in the community. So they're not randomly going along and picking people out, but they're just messaging out into those communities, and we're seeing really good rates of testing.
Particular pack and save in Auckland that's been noted as a location of interest, I think 6 times now. Would it make sense to try and capture that community as that
via that supermarket?
That supermarket?
Yeah, look, I take advice from our team in Auckland. They've been doing this for a while through several outbreaks now, and their current thinking is very much that actually they've got good coverage in the suburbs to cover off those populations they want to get the surveillance testing of, and they do have some experience having tried it before and not finding very high rates of take-up, because people, if they're going to the supermarket, may well be joining a queue for their to get their groceries, and it may be a lengthy outing already.
Yeah.
We're hearing from some Aucklanders that you're asking them to get tested, but some of them can't get to the testing sites. Is more effort required to expand the mobile testing teams to get to those who don't have cars or can't afford to travel?
And we do use mobile testing. Yep.
Yeah, look, there are still over 20 community testing centres set up, as well as, of course, general practices and urgent care clinics. And I know that they are using the mobile testing teams to get out, and particularly into those suburbs where they are looking to do the surveillance testing.
Look, I'll ask the question about the team, because we've talked a lot about the use of supermarkets. Because, look, ultimately what we want to do is reach into certain communities and get good levels of testing of those with mild symptoms, but also have our teams reach in and determine who they want to do that asymptomatic testing of. And it's just a matter of where and how you find those people. We've raised the option of supermarkets. The team on the ground have had a particular view of how they see it as being best done, but we'll ask the question about the pack and save because it's a good question to ask.
I'd ask you about Cabinet paper in August last year, which I'll quote to you: vaccines for early delivery will be more expensive. For example, $75 to $150 per dose compared to later delivery, perhaps less than $15 per dose. Modelling suggests the size of the funding required is highly sensitive to the number of early access vaccines that we choose to purchase. The government then didn't announce our advance purchase agreements till October. Did Cabinet decide not to try for it?
Absolutely not. I do not need to go back and look at any Cabinet papers from that length of time to tell you that we absolutely did not make a decision to delay vaccine for price purposes. Absolutely not.
So we went to those companies and asked for early access.
In all of our advanced purchase arrangements, keep in mind we were in talks with vaccine companies who were at that time promoting vaccines that hadn't even finished their clinical trials. But we were entering into discussions and arrangements and sometimes purchase agreements before completion, simply so we could make sure we were in line to receive doses if they then proved to be safe. And so we entered in those negotiations very early on, but I can tell you at no point did we, for instance, say, we'll delay ordering something from there so it will be cheaper. Absolutely not.
To be clear though, we did seek those higher priced early access vaccines.
My recollection of all of the negotiations was that we were entering into discussions as soon as we could for those vaccines across our portfolio, because you'll remember that we chose multiple vaccines because there were different ones under trial, RNA vaccines, AstraZeneca, those who are slightly more traditional. We were entering into discussions with all of those to cover ourselves so that if one proved to be unsuccessful, we'd have alternate options. That was the basis of our choices and our negotiations, not price point. We wanted the best vaccines possible for New Zealanders.
But the Cabinet did make a conscious choice to try for those early access vaccines, even though the prices were high.
Yes, that's my absolute. At no point did we say we're opting out of any of those options because of price. It was all about efficacy. Which ones cover us? Because as you saw, there were a range being developed, and our portfolio was all about how do we make sure that we're covering all our bases, keeping all our options open while everything's in a trial stage.
Yes, in May, June, July, many countries had already announced advanced purchase agreements. Were we late to that point?
No. So you can see that we often announced advanced purchase agreements well before even clinical trials were completed, and then at different stages, different countries then engaged in rollouts depending on their comfort level with where those trials were at and their regulatory processes. So that often determined a difference for most countries. Okay. I'll come down the back to Jason.
Prime Minister, would it be your expectation that if police saw a funeral or a tangi happening somewhere in the community with well over 50 people, with a lot of people unmasked, that they would work to break that up?
I'm not from the vantage point here going to give a view on how police undertake their operational duties. They are best placed to make those decisions in the moment in time. They, of course, know the orders that they are able to enforce, and we leave it to them to do their job.
But shouldn't it be a blanket rule that if that is happening in the community?
Well, the order and the ability to enforce exists, but we leave it up to the police to determine how and when that is done. Those are all operational decisions, and they, of course, in those moments, are best placed to determine how to do that safely.
So you would be disappointed to see a large-scale gathering in level 4?
I'm not going to stand here and make judgments around the way that police are doing their job. It's their job and it's a hard job. But look, from time to time we have seen breaches that is not representative of what the vast majority of New Zealanders are doing, and the police, do a good job on our behalf of dealing with those scenarios when they arise. Yeah, in the front.
Have you given the police any advice? And if so, what was that advice around the couple that travelled to Wanaka previously? They've said in situations where people have breached a health order that they've taken advice and leave from health officials.
We haven't been asked to give any advice to police, and the matter for prosecution is in their hands, and I think it's very clear in the order what the expectations are, so I don't think they've needed to come back to us for any further advice on that.
Why haven't they come to you? Like last August, I think, or maybe in February this year, when there were other health order breaches, there was the police would come to you or the ministry.
Some cases you were involved in as Director General taking a role, but these are very clearly set out in the orders.
Yeah, it must have been a different scenario. I do recall the one you're talking about, but there was a different scenario, and yes, they were asking us, in a sense, to lay the complaint with police and advise around prosecution. That's not necessary in this case.
Yeah.
And is the ministry or MedSafe working on improving COVID-19 drugs such as, and you'll have to excuse my pronunciation of these, Regencov or Sotrovimab for preventing illness, and if not, why not?
Is it treatment of illness, I believe?
Yes, so we've got efforts going on to both, of course, follow the evidence around emerging treatments. Pharmac is part of those efforts to ensure that if there are effective medications, that those can then be funded. And I do know that there is a medication that was approved in the UK a couple of weeks ago, and an application is with MedSafe that was put in really quite quickly and is going through their process at the moment.
Australia approved one of them last month, and the US approved another one of them back in May. Why is it taking so long to approve them here?
I just need to know exactly which medications they were, and I can check in with MedSafe to see that they may well have had applications, but they can't approve a medicine until an application comes in and all the evidence is provided. But I'm happy to follow that one up.
Some of them are existing drugs that are then used for the treatment of COVID-19, so that also may be a complicating factor.
On vaccination rates,
Ben.
Thank you. The 55,000 today, I think, is the worst day in a month when you take out weekends and the day that you couldn't vaccinate. What's your advice on why it's so low, and is it good enough?
Well, I mean, keeping in mind that, of course, at some of our highest planned rates previously, we were scheduled to be around the 50,000 mark. So circumstances have definitely led us to be in a position where we know that we have the capability and the capacity to go much higher than that. And so really that's my message today. We know we have that capacity. We know that we can do more. So for everyone that is currently booked and might be just waiting their turn, the message we're sending out is you can bring that forward, and you should bring it forward. Get vaccinated as soon as possible.
That number, because it does feel low compared to the last 3 weeks. We're expecting this natural drop-off?
Look, so we do within the team, of course. There's a number of things that you expect to see with the distance between from when you have a large number of first doses, that then you then get large numbers, of course, when they come through for those seconds, when they're due to it in 21 days to 6 weeks' time. So there's lots of modelling around what to expect then. The modelling in this period of time has been difficult because we've seen such extraordinary rates. So we've already moved away really from those planned projections where we had anticipated that at a maximum we would be doing 50,000 a day. We're doing more than that, and we've consistently done more than that, and now we're telling New Zealanders, you can keep going. We've got the capability to do that.
I also asked on the flower protest outside Parliament. I understand Ashley Bloomfield giving a bouquet of flowers. Do you have sympathy for the hundreds of flowers that had to be mulched over the last month?
I do, and they sit alongside a number of industries where, because our goal at this point is just to limit as much contact between people as possible, that they haven't been able to go about their usual jobs and their usual livelihoods. And I can only imagine how tough that would be. Yep.
Why can't they sell at a level 4? And will you
it's all about cumulative risk. So the people that are operating at level 4, of course, are those that are determined that we need in order for New Zealanders to continue to survive and continue as much as possible those essentials of life. And so that heavily falls around food production. But you can see in Auckland that we've actually had a number of cases that have happened in those food production environments. So we try and reduce risk simply by having as few people who need to be working as possible.
And we're going to break away from the news conference now, but you can keep watching on our website, newshub.co.nz. Just recapping those key points. There are 15 new community cases in Auckland today, all of them household contacts of previous cases. That brings the total number of cases since the outbreak began to 970. 394 of those have recovered. The one mystery case reported yesterday has been linked, and there are now just 10 mystery cases from the past 14 days. 22 people are in hospital, 4 of them on ventilators. Wastewater tests have detected traces of COVID in Pukekohe, south of Auckland. Officials believe it might be from a person staying at an MIQ, but anyone in Pukekohe with symptoms is urged to get tested. The Prime Minister has repeated her message from the past few days: vaccinate, vaccinate, vaccinate. She said mobile bus clinics will start rolling out on Auckland streets from Thursday, similar to Australia's Jabba the Bus vaccination clinics. And she said the city could hit 80% coverage of first doses by next week. Well, I'll be here at 4:30 with the latest, and Melissa Chan-Green will be back at 6 o'clock with a full wrap of the day's developments. I'm Michael Roberts. Good afternoon.